Hey Joe, it's just about time to get your teeth cleaned. We have an appointment next week. But don't worry, I'm going to take you down to Animal Care Clinic today. You can meet with some of the veterinary nursing team and the doctors too. They're going to show you what's going to happen and they can reassure you that it's going to be really easy. Okay Joe, let's go! We're here! Let's go see if we can get that worried look off your face.
Hi Joe, welcome to Animal Care Clinic. My name is Bethany and I'll be showing you what to expect when you come in for your teeth cleaning next week. Let's go into an exam room. This is where your big day will start.
This is Zeke. He's going to have his teeth cleaned today. Melissa is talking to his person, Mrs. Blackwell, to be sure we have a very thorough history. She is determining what medication Zeke is taking, when he last ate, and if he has any history of seizures or heart disease. Melissa is also reviewing Zeke's full medical history. She will be giving Mrs. Blackwell an outline of expected costs and timing for the day, and will be sure she has all of Mrs. Blackwell's contact and phone numbers. Oh, it looks like Zeke's heading into our treatment room to meet Dr. Bison. Let's go watch. So, Joe, now Melissa and Zach are performing a physical exam and recording all the vital signs. They will be making sure the computerized medical record is accurate and will also record information on Zeke's anesthesia planning and monitoring forms. Now, they are getting a blood sample and giving Zeke an antibiotic. This is not the most pleasant part of the day, but it's over quickly. Every animal that has anesthesia at Animal Care Clinic has some level of blood analysis. The types of tests we run are based on your age and overall health. Since you are young and healthy, we will only run a few tests. Every pet having a teeth cleaning needs antibiotics to prevent bacteria from traveling through the bloodstream to places like the kidney or heart. Oh, here's Dr. Bison. She will be overseeing Zeke's case today. She has already read Zeke's full medical history and record. Now she is reviewing today's vital signs and lab results, and she's doing a complete physical exam. Dr. Bison will record all of her findings and then determine what the safest type of anesthesia will be for Zeke today. She is considering every possibility as she develops a protocol specifically for Zeke.
While Dr. Bison works through Zeke's information, we'll let him rest a little in our ICU. This is where most of our anesthetic patients spend their day, close to the procedure team and fully visible from the treatment room.
Zeke and our other patients have a soft, warm place to hang out today. No cold stainless steel for our patients. And look at the little houses the kitties get to hide in. We often leave the cats in their own special room before anesthesia so they do not have to hear, see, or even smell the dogs. Zeke is going to take a nap now while Melissa, Zach, and Dr. Bison take the same thorough care with our other patients who are here today. Would you rather take a tour or go get a Starbucks while we wait for the next action with Zeke? Hey look, Joe, Zeke is getting a shot. This is his pain control medication that also acts as a little sedative. This will help Zeke to relax, so he won't worry as we start anesthesia. It takes about 30 to 60 minutes for the injection to kick in, so he'll go back to rest in the ICU while we finish our coffee. Boy, Zeke looks really relaxed now. Melissa and Zach are placing a catheter into the vein in his arm. They will use this to inject medications and anesthetics. They will also use it to administer IV fluids. This is extremely important in helping to make sure anesthesia is safe and comfortable. Our doctors feel that the pets who receive IV fluids feel so much better than those that don't, that they require every pet under anesthesia to get IV fluids. It looks like Dr. Bison has reviewed everything and authorized the beginning of anesthesia for Zeke. Jessica and Melissa are all ready with the proper injectable anesthetics, and an endotracheal tube is prepared. At Animal Care Clinic, only licensed, registered veterinary technicians and veterinarians are allowed to induce anesthesia. This is not a time to cut any corners. We take your safety very seriously.
As soon as Zeke lost consciousness, Melissa placed an endotracheal tube into his main airway and attached it to an anesthesia machine which delivers oxygen and inhaled anesthetics. Now, Melissa and Jessica are placing our anesthetic monitoring equipment.
We use a continuous ECG to monitor the rhythm of the heart. Jessica has applied a blood pressure monitor and will record Zeke's blood pressure every 5 minutes. The pulse oximeter measures the oxygen saturation of the blood. We monitor this continuously. Jessica is going to stay with Zeke through his entire anesthesia. She will keep track of all of his vital signs. If anything changes, Jessica will tell Dr. Bison immediately. This intensive monitoring is one of the things that really sets Animal Care Clinic apart from most general practices. Melissa, our RVT, is taking some precautions to protect herself from all the bacteria in Zeke's mouth. She will start her cleaning with an ultrasonic scaler. This removes the large chunks of calcified plaque on Zeke's teeth. Now Melissa is using the same fine instruments your mom's hygienist uses to get every last bit of plaque and tartar from the teeth, and especially beneath the gum line. You can see how hard it is to get to the inner surfaces of the teeth and to the ones way in the back. The most important part of the cleaning is getting beneath the gum line to remove plaque and bacteria. This requires a firm but gentle touch to avoid damaging the gums. You can see why anesthesia is needed for a thorough, safe, and comfortable teeth cleaning. Can you imagine someone trying to do that to you when you're awake? Melissa's final job is to polish all surfaces of all the teeth so they are smooth and squeaky clean. Dr. Bison is now going to do a complete oral evaluation. She will look at every tooth, check for masses in the mouth and other lesions, and will measure the depths of gum pockets. Looks like Zeke's teeth are in great shape. If Dr. Bison had found any problems, she would have called Mrs. Blackwell to talk about the next step.
She might recommend x-rays, mass removals, or even extractions. The doctors at ACC are great at dentistry and can handle almost any problem they come into contact with.
It is time for Zeke to wake up. Melissa and Jessica are cleaning up a bit as they wait for Zeke to regain consciousness. They will not leave his side until he is ready to have his endotracheal tube removed. Zeke is back in his comfortable ICU suite. He is awake but still very sleepy. Melissa and Jessica are watching closely and monitoring his vital signs on his post-op form. They will also look for signs of pain or stress and alert Dr. Bison immediately if anything seems amiss. Zeke's mom is here and he is ready to go. Those IV fluids and customized anesthetic plan really helped him wake up smoothly. Doesn't he look great?
Well, Joe, that's all there is to it. You'll do just fine next week, and your health will be greatly improved because you take such good care of your teeth. Aren't you excited to have fresh breath and a clean mouth?